Kitchener-Waterloo.
Thank you very much, Mr. Speaker. You know, this past weekend I was in my riding and there was lots of questions about eHealth.
Who, please?
This is to the Premier. The modernization of eHealth, the optimization, the leveraging of eHealth. This Premier and her Liberal government seem obsessed with privatization. Private energy contracts that build in profit margins for companies, selling off Hydro One to the private sector, and now asking their privatization expert, Ed Clark, to figure out the sale price of eHealth asset. If she is not planning to sell off part or all of eHealth, why did the Premier and the Minister of Health, in his letter, ask Mr. Clark to figure out how much money the province can get for it? It's a good question.
Minister of Health and Long-Term Care.
Minister of Health and Long-Term Care.
Well, you know, Mr. Speaker, I have to repeat. I'll repeat it as many times as I need to, that eHealth is not for sale, nor are any of its components, the records that are held within. In fact, Canada Health Infoway, to a large degree, inspired us to approach Ed Clark because Canada Health Infoway has valued electronic medical records and the eHealth system in Ontario as providing substantial benefits to the province, and has actually attached a dollar value to that. And I think it's important as we look forward to taking advantages of opportunities, new technologies, the strength that we have already seen in the building of eHealth in this province, that we look at the assets that we have. We do an inventory to see what assets we have, and we use that to build a stronger eHealth program. We identify if there are gaps, we fill those gaps. If it allows us to invest more in consumer, public-facing eHealth aspects as well. This is the kind of work that Ed Clark is helping us with.
Supplementary.
Thank you very much. Well, Mr. Speaker, Mr. Clark spent $6.8 million on consultants to come to the conclusion that the province should sell off Hydro One. Now the Premier and her Minister of Health have asked him to put a value on eHealth. Surely Mr. Clark won't be doing this alone for free. How much will the people of Ontario be paying the high-priced consultants so that Mr. Clark can make the case to privatize our eHealth assets?
Thank you. Minister.
Well, again, Mr. Speaker, we're not selling eHealth. We have no plans to. We won't be selling it. But I want to talk. It gives me the opportunity to talk about those assets that we're asking Ed Clark to value. Where in about a decade ago, less than 1 million Ontarians actually were benefiting from electronic medical records, and today more than 10 million Ontarians have an electronic medical record, and there are 12,000 providers that are providing that service to them, right down to the family doctor or nurse practitioner, where we know that more than 80% of primary care providers are using electronic medical records in their practice. We have medication history is accessible for all our seniors. That's accessible in all our hospital and emergency rooms. Imagine that. Before, when I was practicing as a doctor in a hospital, I would have to go into the back room and pull the files for seniors, which would often be very big. Now we have immediately access to their medication list for seniors in hospitals.
Thank you. Final supplementary.
Thank you very much. Well, you know, modernization, optimization, leveraging eHealth. We need a privatization thesaurus on this side of the House to keep track of what's happening with this government. The Hydro One sell-off has been disastrous for the people of this province. The FAO confirmed we will be in a deficit position after the next election because of revenue loss. We've also seen rates so high that families are forced to choose between saving for their children's future or paying for their bills. This is the reality of the people of this province. Consultants are about the only group who have done well by the Premier's wrong-headed sell-off. The people of this province paid the last consultant bill of $6.8 million. Wow. Will the Premier tell us now how much will it cost Ontarians in consultant fees for her to decide to sell off another vital public asset, our eHealth asset?
Question. Thank you.
Well, you know, the third party can spin this or try to spin this any way they want, but the truth is, Mr. Speaker, we're not selling eHealth. We actually want to make it better and stronger, take advantage of the expertise that exists in this province and indeed around the world. We're going to be doing it. It's explicit in my letter in concert with the Information and Privacy Commissioner, because paramount is the protection of that health data of individual Ontarians. But we have to admit that even for laboratory lab test results, we have more than almost 3 billion lab lab test results for nearly 10 million Ontarians stored digitally, stored electronically. We have more than 700,000 hospital reports that are sent digitally every day to patients' primary care providers so their family doctors can provide better care. This is an amazing system that we've built up over the past decade. We have much more work to do. By having Mr. Clark look at the assets, he can help us understand how we can make a strong system even stronger.
Thank you.